Good afternoon, Mrs. Jackson.
Hello.
My name is Dr. Amal, and I'm one of the dentists who will be seeing you today. How can I help?
I have very, very bad pain in one of my teeth. It's such bad pain that I'm really struggling to even explain it.
I'm so sorry to hear that. I'll try my best to help you. Can I ask you a few questions if you don't mind?
Yeah, go ahead.
Where exactly is the pain?
It's like right above my front tooth, in the gums. It really, really hurts.
Okay. And is this the first time you have this pain?
I had some mild pain maybe a few months back, but it wasn't something that I really bothered myself with.
Okay. Did you take any medication to help yourself?
I've taken some paracetamol, but it makes no difference.
Okay. Did you seek any dental treatment on this particular teeth?
No, I haven't done anything about it before. Now the pain is so severe that I can't even sleep.
I'm so sorry. But any history of, hit or trauma, if you remember?
Well, actually, now that you mention a few months back, maybe 6 or 7 months back, I did have a bit of a bump into the tooth, but I didn't really think much of it at the time.
Do you think your tooth is a bit wobbly?
Maybe after the hit, it's become just a tiny bit loose, but I don't know if I would be able to tell the difference.
Okay. And is there any sort of swelling or a bulge on the gum?
Yes, yeah. So right above the front tooth, there's I can feel with my tongue that there's a bit of a swelling. Yeah.
Okay. And do you have any fever?
No.
Okay, fine. From the explanation you have given, Mrs. Jackson, that I can say that you are having a condition called the acute periapical abscess. Please excuse the term. I will explain what's happening.
Okay.
What's happening is because you told me that you had a hit on this particular tooth, which has actually irritated the nerve and it's got infected. Unfortunately, the infection has now crossed the tooth, and it has been, the fluid of the infection called the pus. It is getting deposited at the tip of the teeth. I know it sounds awful. And can you see this bulge? This is all the fluid which is getting deposited here.
Okay.
Okay? But don't worry, I'll try my best to help you today. For immediate relief of pain, what I will do is, under the effect of a numbing injection, I will give a little cut in the gum, which will
that sounds very painful.
It will be under absolute, numbing injection. So I'm sure you'll be fine, right? So I will give a little cut that will immediately relieve your pain, because see, it's a small area and the pressure of the fluid is just building up.
Okay.
Yeah. So I will give a little cut in this area, which will just ooze out all the infection, and it will definitely relieve your pain. All right?
Okay.
Any questions for me so far?
I guess not. It just sounds terrible, really.
I know. So, and also, what I will do is I will drill a little hole in the tooth, and I will just clean off all the infection from inside as well. So this, if I clean it just from outside, it's more likely that it will reoccur. We need to fix the source of the infection, which is the actual tooth. So I will just clean the tooth up to the tip and remove all the infected nerve from inside and give a dressing and leave it for some time.
So you can do all of that in one session?
Yes, today.
Okay.
This is the emergency treatment for relief of pain. For a longer term, it's your choice whether you want to keep the tooth or you want to remove the tooth. That's a different set of treatment option. We can discuss it in the next appointment if it's okay with you.
But is it likely to concur? Can it happen again after you've done the drilling?
No, it will not I will do the permanent filling if you want to keep the tooth, not until the infection is completely healed.
Okay.
Yeah?
Okay.
There is no 100%, I can't say 100% no, it will never reoccur, but there is always a slight chance of any infection or, failure of any treatment.
Okay.
Yeah?
Yeah, I understand.
So this is the main line of treatment. I will also advise you to take some rest at home. Don't go for any heavy exercises. Take the off, plenty of fluids. And I will also prescribe you some painkillers.
Okay, good.
Stick to a soft diet for today so you don't put pressure on that particular teeth.